Hello everyone. Today, we're diving into the world of a medication called Isosorbide Dinitrate, commonly known by its brand names, Isordil and Sorbitrate. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Isosorbide Dinitrate, known by its brand names Isordil and Sorbitrate, is a medication used to prevent chest pain, angina, in patients with certain heart conditions. It belongs to a class of drugs known as nitrates. Nitrates work by relaxing and widening blood vessels, making it easier for blood to flow through them and reach the heart. This helps to reduce the heart's workload and relieve chest pain. Isosorbide dinitrate is typically prescribed for the management of angina pectoris due to coronary artery disease. It can also be used to treat heart failure, either alone or in combination with other medications. Warnings: Isosorbide dinitrate comes with its set of precautions. It should not be used if you are taking medications for erectile dysfunction, such as sildenafil, Viagra, tadalafil, Cialis, or vardenafil, Levitra, as the combination can cause a serious and potentially life-threatening drop in blood pressure. Additionally, it should not be used if you have severe anemia, closed-angle glaucoma, or head injury or brain hemorrhage, as it can exacerbate these conditions. Before starting isosorbide dinitrate, it's essential to inform your healthcare provider if you have any allergies to nitrates. Patients with low blood pressure, volume depletion, or those prone to dehydration should use this medication with caution. This medication may also cause headaches, which are a common side effect due to the dilation of blood vessels. Before taking this medicine. Before starting isosorbide dinitrate, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug or any of its components. If you have a history of heart conditions, low blood pressure, or other serious illnesses, discuss these with your doctor. Women who are pregnant, planning to become pregnant, or breastfeeding should consult their healthcare provider. Regular monitoring of blood pressure and heart rate is advised for those taking this medication. You should not take isosorbide dinitrate if you have certain medical conditions, including severe anemia, closed-angle glaucoma, head injury, or if you are taking medications for erectile dysfunction. It's also not recommended for individuals who have recently had a heart attack or have a history of stroke, unless advised by a healthcare provider. Before starting the medication, inform your doctor if you have ever had heart failure, low blood pressure, volume depletion, or if you are prone to dehydration. It's also essential to let your healthcare provider know if you have kidney or liver disease, as these conditions may affect how your body processes the medication. Side effects: all medications can have side effects, and isosorbide dinitrate is no exception. Common side effects include headaches, dizziness, lightheadedness, nausea, and flushing. These effects are typically mild and may decrease as your body adjusts to the medication. However, more serious side effects can occur. These include severe low blood pressure, hypotension, fainting, rapid or irregular heartbeat, and severe allergic reactions, rash, itching/swelling, severe dizziness, trouble breathing. If you experience any of these symptoms, seek medical attention immediately. Additionally, there's a risk of developing tolerance to isosorbide dinitrate, meaning its effectiveness can decrease over time if taken continuously without breaks. To prevent tolerance, your doctor may recommend a dosing schedule that includes a period of the day without medication. Interactions: isosorbide dinitrate may interact with other medications. It's crucial to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Particularly, avoid taking this medication with phosphodiesterase inhibitors, such as sildenafil, tadalafil, or vardenafil, used for erectile dysfunction, as this combination can lead to severe hypotension. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking isosorbide dinitrate. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The usual dosage for angina prevention is 5 to 20 mg taken 2 to 3 times daily, but your doctor may adjust the dose based on your response and condition. For heart failure, the dosage may vary, and your healthcare provider will determine the best regimen for you. Avoid: while on isosorbide dinitrate, it's advisable to stay hydrated, especially if you experience side effects like dizziness. Avoid alcohol as it can increase the risk of certain side effects. Additionally, avoid activities that require alertness, such as driving or operating machinery, until you know how the medication affects you. FAQ. Many wonder about the age restrictions for isosorbide dinitrate. Its safety and effectiveness in children have not been well established. Always consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of isosorbide dinitrate. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.